I know you've been there. I've certainly been there. You need to get a medical procedure or a test done, but you have to wait for prior authorization from your insurance company. Sometimes it comes in like a week, but sometimes it gets denied, and then your doctor has to waste his or her time calling the insurance company on the phone or writing a letter or faxing documentation. Yeah, I said fax in 2025. Now, almost 50 of the nation's largest health insurers that cover almost 260 million Americans have pledged to streamline, simplify, and even cut down on the number of things we all need a prior authorization for.
It's a template for administrative simplification to take the paperwork out of the process and put patients over paperwork.
Yes, that is Dr. Oz, and I will explain what he has to do with all of this in a second, and about the pledge and when you can expect to see changes to your healthcare as a result. But before I do that, I want to thank my paid FaxHQ subscribers for voting for this story as the bonus this week. If you want to vote on next week's bonus story, make sure you become a paid subscriber. There are a bunch of other perks too. Just follow these easy steps. And if you don't want to be a paid subscriber, that's cool too. You can be a free subscriber and you will get access to my daily FaxHQ email. It is an excellent resource, so make sure you sign yourself up. Okay, so a few weeks ago, Dr. Oz, who is the administrator of the Centers for Medicare and Medicaid Services, announced this pledge that these major health insurers made to the United States government. In case you didn't know, CMS not only oversees Medicaid and Medicare, but also oversees the Federal Affordable Care Act marketplaces, so the insurance for your ACA health insurance too. The insurance companies pledge to do 6 things, and if you want to see if your insurance company is on the list, remember that FaxHQ email, the free one that I just talked about? Well, I'm going to send you the list of insurers in that email on Monday. So again, make sure you sign yourself up. So by January 1st of 2026, those insurers have pledged to, 1, reduce the scope of claims that need a prior authorization. For example, CMS officials said there's no reason you need a prior authorization for a colonoscopy or for cataract surgery or for a 2-day hospital stay after you give birth.
Take a given episode of care that might require 2 different imaging studies as well as 3 different diagnostic lab studies all in sequence. Status quo today for many insurers is that each one of those separate components will individually be prior authorized. That's illogical. We know what the episode of care is. That episode of care arguably wouldn't require and shouldn't require prior authorization at all. But if it does, it should be done once, it should be done quickly, it should be done almost invisibly to the patient.
2, make sure your existing prior authorizations are honored during the 90-day transition period when you switch health insurance plans. And 3, if your prior authorization is denied, they will make their own decision-making process more transparent and will offer you an easier way to appeal. By January 1st of 2027, 1, they pledged to standardize the electronic prior authorization system among all health insurance companies that will cut down on your doctor's wait time.
They're facing this kind of Byzantine collection of procedures that they may not know for that particular insurance company, and if they do it wrong, if they correspond by fax, they get denied. And so these companies have now agreed to unify their protocols so that all of them will communicate in the same way and to standardize the process, and that's going to dramatically change the patient experience.
2, once they have standardized that electronic prior authorization system and have it up and running, they will make at least 80% of electronic prior authorization approvals immediately. So no need to wait for that test or that medicine or that procedure. The idea is to get it approved as you're sitting there with your doctor. And then there was one additional pledge that the insurance companies made. They say they are committing to right now, which is that they will all have their doctors study the prior authorizations that were not approved and figure out if those denials were appropriate or not. Now, it is important for you to understand that this is just a pledge being made by these insurance companies. It's not a law. It's not even a rule that they have to follow. And it only applies to about 3/4 of the insurance companies. So there's still a quarter that have not pledged to do this. But Dr. Oz says if the ones that have pledged don't follow through with all of this, then the government has a lot of things that they can do.
But the most important reality is the administration has made it clear we're not going to tolerate it anymore. So either you fix it or we're going to fix it. And I think they wisely have decided that they should fix it.